Well, obviously, we'd rather these strikes were not taking place. They come after 6 months of on and off industrial action, which has taken a heavy toll on the NHS. But we're relieved that it's only a one-day strike. Of course, it was going to originally be two. And also, we're grateful to the RCN for putting in place a rising number of mitigations, specifically agreed with individual hospitals in order to protect life and limb services. So, we will cope with today. It will be difficult. Procedures have been cancelled in order to enable us to manage today. But the critical issue now is that the Staff Council meets tomorrow, and we hope that that Staff Council will work together and accept the deal, and that we can finally end this industrial action, although, of course, the junior doctors' action is still ongoing.
Do you feel these strikes are justified?
There's no question that the pay, the real terms pay of NHS staff has fallen. And there's also no question that our staff are working in incredibly challenging circumstances. The leaders that I speak to day in, day out tell me that they've never been as worried about morale as they are now. We have huge issues about retaining staff. We can recruit staff generally, but we find it difficult to retain them because of their working experiences they have. So, there are genuine issues that underlie this industrial action. But obviously, what we want to do is to see issues resolved through negotiation. And the other, big issue, Jane, is that in the next few weeks, we hope we'll finally see the long-term workforce plan that we've been promised for months, indeed years. Because the underlying challenge is we have 120,000 vacancies in the NHS. So, as I've said before, even if there were no strikes, even if there were no trade unions, we would still have huge challenges about recruitment, retention and motivation in our health service.
You say you want to see these issues resolved through negotiation. The unions are saying that the Health Secretary doesn't seem willing to get around the table and talk.
Well, it certainly took too long for this to happen. We had several months at the beginning of the year when the government refused to negotiate with the NHS trade unions. We called repeatedly for the government to open negotiation, and they finally did. So that was a wasted opportunity. But then that negotiation started. When it did start, there was good progress, and the Secretary of State played his role in that progress. And that's what culminated in a deal that most of the affected staff have accepted. And now the question is whether all the unions will tomorrow accept this deal and we can move on. But as I say, that will still leave major issues the government needs to address in terms of staffing in the health service.
Do you think that nurses' demands are unrealistic?
Well, if it hadn't been for the action that the nurses, the paramedics, other groups took, then they wouldn't have had the pay deal, which is going to be discussed tomorrow. And that pay deal comprises a fairly significant backdated sum and also 5% for this year. So it's been the togetherness, the solidarity of the NHS trade unions that's got them the progress that they have achieved. Otherwise, they would have had a much smaller settlement. But I think our view now is that given that most staff have voted in favour of this deal, it is time to accept it, for the unions to work together, and for us to think more long-term about what we need to do to address, that crisis of 120,000 vacancies in the health service.